the buzzword is crisis. We're in a healthcare crisis right now.
Absolutely.
So what exactly, in your perspective, does that make it a crisis? And where did we cross the line where it became a crisis?
So the reason why it's a crisis is what we're realizing is more and more dollars that we put into even just basic operations, we're not seeing any step changes in health. We're treading water and we're just barely keeping up. The problem is that cost keeps rising, 3 to 6% a year. It keeps rising. And if you look at provinces across Canada, most provinces are getting close to 50% of the annual budget is being spent on health.
Wow.
And so that's why it's a crisis. When policymakers are trying to make decisions on whether to build roads, whether to build schools, or just keep the health system operating, that's a crisis.
Right. So where does the narrative change for policymakers where, I know Health City comes in and says, hey, you guys, we got to start looking at these options. There's other options out there. They're sustainable. Like you said, we're treading water. We can't, that's just not sustainable. When your population keeps growing, but your dollars stay the same, it just doesn't work. So in that narrative, where does the transition come from a policymaker's decision to... What direction does the policymaker go into to start supporting initiatives that change something that they're so used to for so long?
Yeah, it's a really good question, and I'm not too sure if I have the right answer for you, but I'll give you a couple of ideas. One is looking at the fact that health, we have to look at it as a big picture. So other jurisdictions do this, particularly our Nordic friends. When we look at Denmark, Norway, Sweden, Finland, they have figured out that the impact that we can play at the municipal level and at the state or provincial level and at the national level, it's all connected. So when they look at health, they say, how do we tie in the cities? How do we tie in social programs? And it's a robust approach that they're looking at because they know that all these aspects impact health. So Norway is a great example. They're holding the line in terms of how much they're spending on acute care because they're putting a lot more of their dollars up front into the prevention side of things. So that's one area we need to look at. And we have robust systems and capabilities on the social services side, on the municipal side that we need to be tapping into. But what that requires, which is hard, it's both a cultural change and a policy change, is how do we work together with provinces, with the municipalities, and at a federal level to get us all to work together towards this crisis.
Gotcha.
So that's another one. Another initiative which is near and dear to my heart is all these innovations that you highlight on your show, Bryce. How do we get those to impact Canadians? So, I can tell you there's a number of folks that I talk to on a regular basis who say, you know what, we're actually tired of seeing those cool medical story news items. We see it on Global or CBC, and there's a scientist who says, hey, I've got the new cure for XYZ, and trials are starting, and then you never hear about it again.
Yeah.
And I can tell you a lot of people have come back to me and said, why don't we ever hear about those again? What's happening? Well, what's happening is that our system, which is developed to protect the patient, right?
Yep.
It's how do we do no harm, right? So how do we adopt things that do no harm? There are processes in place, there's policies in place to make sure that doesn't happen. There's regulatory approval for products. So we have all these systems in place to prevent that from hurting the patient. But what's happening is that those systems are now so conservative that
it's hurting
it's hurting us. That's exactly it.
Yeah.
And so we need to now figure out and say, okay, well, you know what, the world is changing. Those systems worked really well in the post-war period, 50 to into the 80s. But then after that, it's a brand new world now. And so how do we start getting smarter about health like we did around transportation, like we did around banking, like we did even around education? We're getting smarter. How does health change with the times as well? So that's another area that we have to figure out. How do we bring in these new innovations in a safe way, but in a way that's meaningful, when even the patients are saying, hey, look, I'd like to try this. I'm willing to do this. How can we do that in a safe way and get that to them?